This is the portal vein. This is the hepatic artery. This is the inferior vena cava, superior mesenteric artery, aorta, and this is IVC. This is the lobe of the liver. So there is no significant finding in this region. Now, as she is postpartum and pain was in the epigastric region, we have seen that the pancreas is normal and that the gallbladder is also normal. Here you see, I can get both the gallbladder and as well as the pancreas with a little bit of effort. This is the gallbladder, this is the pancreas, this is the pancreas, this white band of tissue here, and this is the splenic vein, this is the aorta, this is the IVC, and IVC is not dilated, and this is the liver with smooth outer surface, normal epigenicity, no coarseness, no para-aortic plan lymph nodes. Now, as she is postpartum, 15 days postpartum, and all the complications developed after that, let's see the pelvic region. Now, here is the uterus. This is a postpartum uterus, 15 days postpartum. This is the longitudinal section. Of the uterus. The endometrial canal is normal, clear. No evidence of arpeiosis. Uterus measures 12.0 centimeters in longitudinal section, 6.7 centimeters in anterior-posterior diameter. Now, normal uterus should not exceed more than 11 centimeters in length and 5 centimeters in anterior-posterior diameter. This increased diameter is because she is in postpartum period. 15 days postpartum. This is the endometrial canal and it is absolutely clear and central. No focal lesion is seen. This is the cervix. Now you see there is fluid seen in the pelvic cavity. This is the transverse section of the uterus, and this is the transverse section of the uterus. This is the endometrial canal, and the uterus is normal. This area, which appears as there is a focal lesion, this area, which appears in longitudinal section, appearing as a focal lesion. This is, in fact, now this is the urinary bladder. This is the catheter that has been placed. And what is this area? When I maneuver the probe a bit, I can see that this is fluid, and in which multiple septa are seen. This is multi-septated fluid around this is the anterior wall of the uterus, and here you see a documented pocket of fluid is seen in which these tiny linear structures, the thread-like structures are the septa. So there is fluid in the pelvic cavity and there is fluid surrounding the anterior wall of the uterus. This is the catheter bulb in the urinary bladder, and this is the uterus. This is the posterior wall fundus, and this is the anterior wall. Now we cannot rule out any perforation, as you see a linear structure, this linear structure communicating with the fluid with the anterior wall of the uterus. So any maneuver during the labor may have created a tear in the anterior wall. We cannot rule out that possibility because there is significant amount of fluid seen in the pelvic cavity. This is all fluid. This is fluid. This is fluid. And this fluid can be seen tracking upwards in the this is fluid. No, these are bowels. I'm applying jelly. And you will be able to see fluid in the hepatorenal angle, in the Morrison's pouch. Now this is fluid. This is the right kidney. This is the right kidney. This is the liver. And this is the fluid in the Morrison's, this is the fluid in the Morrison's pouch. So there is fluid in the Morrison's pouch coming down. We see the uterus. Now on the left side, let's move to the left side and see the spleen. This is the spleen, and there is fluid. You can see fluid. This is fluid, this black area. This is the diaphragm. This is the spleen. And here is the pleural effusion. You see fluid above the diaphragm. This is the fluid above the diaphragm, which is the pleural effusion. You must see on the right side as well. And you can see fluid in both pleural spaces, which is minimal in amount, but there is fluid. So there is fluid in both pleural spaces, minimal in amount, may be reactive or sympathetic. This is the liver, this is the spleen, this is the diaphragm. So there is fluid seen in both the pleural spaces. What about the right Morrison's pouch? And this is the left Morrison's pouch, and you can see fluid in the left Morrison's pouch as well. This is the fluid in the left Morrison's pouch, and these are bowels. These are all bowels. You can see movement of particles within it, and ostrations are also seen. So these are all bowel and bowel gases. This is also bowel, and this is the fluid that you are seeing in the left pleural space. This is the right side, and you can see the bowels. These are all bowels. This is not fluid, as gases can be seen. Particle movements will be seen. Coming down again. Now see, there is significant amount of fluid in the pelvic cavity. With equals, the fluid is not clear. You can see the amount of fluid in the, this is the uterus, and this is the fluid with equals this black area. And there is also fluid here in this. Now this area is suspicious. Anterior wall of the uterus showing septations and fluid with septa. Now this is the anterior wall of the uterus. This is the fluid. This area is the fluid. This is the urinary bladder, and this area is the fluid with internal echoes, sorry, and with internal septa. These tiny linear structures are septas, and the echoes within this fluid. So this is not a clear fluid, this is possibly a bleed. This is longitudinal section of the pelvis. So this is a study of a 15 days postpartum female with complications in the form of blood in the pelvic cavity, in the left paracollic gutter, and in the Morrison's pouch.